The journey to becoming a nurse officially started when I got accepted into the Indiana University School of Nursing. Since that day, I have learned so much about what being a nurse really entails. The ANA defines nursing as the protection, promotion, and optimization of health and abilities, prevention of illness and injuries, alleviation of suffering through diagnosis and treatment of human response, and advocacy in the care of individuals, families, communities, and populations. All of this is very true, but I think that the quote from Maya Angelou, "People will forget what you said, people will forget what you did, but people will never forget how you made them feel," truly embodies what's important about nursing. I will need to integrate these ideas into my nursing career every single day. Nursing has changed so much throughout history and has become so much more than patient care. It has turned into a profession. This means that it requires higher education, standards and a code of ethics, responsibility, and commitment to my patients as well as my other team members. As a professional in nursing, I need to not only stay up to date on nursing legislation, but also help to improve it for my patients. I am also responsible for the advancement of my knowledge through scholarly inquiry in order to ensure a safe, quality, and evidence-based practice for all my patients. Most critical components to being able to effectively work as a nurse is teamwork. As a nurse, I will be working with doctors, physical therapists, dietitians, and other nurses, as well as many other healthcare professionals. This promotes interprofessionalism, which leads to better patient care and a smoother experience for all those involved. There are 3 components that go into effective interprofessional teamwork: communication, collaboration, and coordination. Although they are all important, communication is often one most emphasized because many people battle with doing this successfully. Communication is so important to patient care and takes practice and awareness of yourself and others. What you say is just as important as how you say it. As a nurse, I need to make sure that I am not only giving the patients and other team members the right message, but I say it in a way that it is not confusing nor aggressive. Knowing the difference between being aggressive versus being assertive is so vital to effective communication in nursing. Being assertive means that I stand up for myself, express my feelings and concerns, understand who I am and what I value, and practice professionalism when advocating for the patient. Being assertive means that I am being confident, direct, and honest as a nurse, which will gain me respect from my peers, patients, and myself. This also means that I will listen to what my patients and other team members have to say. Being aggressive means that I am standing up for myself in a way that violates the rights of others, and I attempt to humiliate or put down another person. Being passive means that I fail to stand up for myself, allowing my rights to be violated. Both of these alternatives to assertiveness can lead to a decrease in patient care quality. I know being assertive is something that I need to work on, but I'm willing to do this in order to give my future patients the best care possible. I know that in my career as a nurse, I will help manage conflicts and crises, and knowing how to effectively communicate will help win these situations. Without communication, nurses would not be able to provide the best care possible for their patients. Throughout my education here at the IU School of Nursing, I will continue to learn and implement the skills and strategies that I will use every day in my career. I know that it is important to take care of myself in order to take care of my patients. Nursing is one of the most stressful and demanding jobs in the workforce. It is important that I find a way to deal with stress so that it doesn't affect my ability to care for my patients. Although it seems so far away right now, graduation will come, but that doesn't mean that the learning will stop. As a nurse, I will continue to learn something new every day and hopefully go back to school to continue my education. My goal as a nurse is to make sure that I treat the patient as a whole and ensure that they are getting the most proficient, safe, and optimal care possible.